as we all know, the renal cancers are histologically different tumors. Not even a single subtype of renal cancer is the same. We have different types like papillary carcinoma, chromophobe carcinoma, and even clear cell carcinomas. So they are based on different morphologies, based on different genetic mutations. So the important question is when to get the genetic testing done, and what are the different type of tests that needs to be done for the appropriate diagnosis. So before that, I would like to discuss about the different types of genetic tumors in renal cell carcinomas. The one is the sporadic, and then we have the germline. We'll first talk about what are sporadic tumors. Sporadic tumors are the ones in which the genetic mutations are seen only in the tumor. They are not seen inside the body of the patient. So majority of the renal cell carcinomas are sporadic tumors. So when we test them, we might be able to understand the aggressiveness or even the prognosis of the patients by looking into the genetic mutations that we see on the testing. And the second one is the germline testing. In the germline testing, the patients inherit the gene from the parents, and they are passed from one generation to the next generation. So in that particular case, when to get the testing done for the germline is when you have a family history of renal cancers, number one, or you have the tumor presenting at a younger age, or you have a tumor associated syndromic cancer in your body like a brain tumor or a pancreatic cancers, which are associated with the syndromes. So that is the time when we need to break the inhibitions and come forward for the germline testing. So the next question is, what are the benefits of genetic testing? The benefits are that it helps us to streamline and personalize the treatment plans for the patients. Example, if we have a VHL gene, if the patient is positive, the patient is eligible for the targeted treatments like HIF alpha inhibitors. So this helps us to understand the reoccurrence. It helps us to understand the different type of cancer syndromes which might be associated with the VHL syndrome. It helps us to stratify the risk factors which might be responsible for these types of cancer syndromes, and it helps us to personalize the treatment plans individualized for every patient. So regarding this, we have a 2-tier genetic counseling and consultation available at Kokilaben Dhirubhai Ambani Hospital. The pre-test genetic counseling, which helps us to understand the need for genetic testing, the clinical scenario in which you need the genetic testing, and a post-test counseling sessions are also available, which helps us to understand the treatment protocols. It also helps us to understand the guidelines which are available in NCCN to personalize the treatment plans. In this post-test genetic counseling, we also helps the patient understand the gene which is involved with this cancer and whether that gene is autosomal dominant or autosomal recessive, and the types of inheritance associated with that particular gene. We as a patient, we share our DNA with our families. So it's important that we discuss our news with our family members. So we also help the families understand the significance and the prognosis of the gene, and emphasizes the significance of screening protocols to prevent the occurrence of cancer. So genetic testing helps us to screen, to diagnose and treat the patient better based on the personalized treatment protocols which are specifically designed especially for each different gene and each different patient. Thank you.